more like it's more like this. So these would be the segmental, and then these ones would be the interlobar, and then these are the arcuate, and then these are the cortico-radiate arteries, and that would take you to the afferent arteriole. It finishes up as a tuft of capillaries in here. That would be the glomerular capillaries, used to be called glomerulus. And then the blood is going to leave here by way of the efferent arteriole. So after that, they can either go to wrap around the proximal and distal convoluted tubules, and those would be the peritubular capillaries. If they wrap around the nephron loops, then those would be the vasa recta. Then they will come back to the cortico-radiate veins, arcuate, and then interlobar veins, and then renal vein. So that's the flow of blood. And then for the kidney, out here you have the capsule, okay, renal capsule, and which is dense irregular connective tissue. Then this would be the cortex cortical region, and then medullary region would be where you have the pyramids and the columns, and then this is where you have the pelvic region, and this is the final part that we refer to as the pelvis of the ureter. So the renal pyramids, between them you have the renal columns, and then as far as the pyramids go, the tips are the papillae, and then within the pyramids you're going to have those or these collecting ducts, or collecting tubules. And then when these things converge all the way to the papillae of the pyramids, that's where you usually have some books referring to those as the papillary ducts. So all right, so the arcuate artery and vein would be right at the border between the cortex and the medulla. And then these knobs, they represent the renal corpuscles. So there's the renal corpuscle. Renal corpuscle, you have two things. You have the glomerular capillaries, you have the glomerular capsule. So glomerular capsule, you have simple squamous cells here for the parietal, and then visceral, those would be the podocytes, the green ones are the podocytes. It's the capsular space. The filtrate of the blood is going to come to the capsular space, and then it will continue down into the proximal convoluted tubule. Then the lining is going to be changed to cuboidal cells, simple cuboidal cells with these tall microvilli. That's what the blue represents. So these things are color-coded. That means these two are also proximal convoluted tubules. So that would be the yellow one here, and then the white would be the descending limb, the green would be the ascending limb, and then the yellow would be the distal convoluted tubule again. So these are the distal convoluted tubules, cuboidal cells, and then this one also shows the parts of the juxtaglomerular apparatus. So this would be the distal convoluted tubule, where you have the macular densa cells, this row, And then on the smooth muscles for the afferent arteriole, you would have the granular cells used to be called JG cells. These ones here are the extraglomerular mesangial cells. Okay, so these are the ones that would be modulating the chemicals sent out here to the juxtaglomerular cells or granular cells. So if these things detect a drop in solute level in the filtrate, which is almost the last chance for it, because this is very close to where you have the collecting tubule, and it's pretty much on its way out as urine. So if you still want to recapture anything, this is your last chance to do it. So this is when the macular denser cells should be sending the chemicals over to target the granular cells release renin. So renin is going to shorten angiotensinogen, which is already in the blood, into angiotensin 1. And angiotensin 1, wherever they go, wherever you have cells that would respond to them, those cells would release angiotensin converting enzyme, or ACE. Used to be thought, they used to, and it's in almost all the textbook until recently, that the blood would circulate all the way to the lungs. Around the alveoli of the lungs, you have the cells that are sensitive to the presence of angiotensin 1. So, but now we know we have those cells in many parts of the body. So those cells that are releasing ACE that would shorten angiotensin 1 into angiotensin 2, which is a potent vasoconstrictor. So wherever that flows, those blood vessels will constrict the lumen. Okay. So that's how you raise your systemic blood pressure. So anything that is not recaptured here is going to continue out to the collecting duct or collecting tubule. That's this one, also cuboidal cells. Okay. So you can be asked many different things on here. Okay.
So what was the difference? I know these were the penetrating capillaries.
Yeah.
What was this one though?
Those are the podocytes. Yeah, it's referred to as a visceral layer. Yeah, so out here is the parietal layer. This is the visceral layer.
Oh.
Yeah.
And where is this on this?
The orange thing. Yeah. So, yeah, make sure you. Oh, as far as the calyces go, okay. So figure all these dots here represents the papillary ducts, okay, and then the individual sleeve around the papilla would be the minor calyx. When they converge onto larger ones, that's when you form major. Okay, so these are minor, and then out here, would be major. Okay, so those are the structures you need to be able to identify.